Dear participants, I'm really pleased to welcome you on our people-centered, right-based TB legislation session, the project based on information which was gathered in Eastern Europe and Central Asia region. And this session will present the results of a new groundbreaking legal study from the Global TB Caucus and the TB Rep to their project in Eastern Europe and Central Asia countries. The study is a part of a larger project that involved 3 regional workshops with members of parliaments, civil society representatives, and people affected by TB. As I don't have a lot of time to go through this introductory session, you can read it in our information, but I will do the quick introduction of our next speakers, who will be Brian Citro, Oleg Klemenko, and Malahat Ibrahimizli. Brian Citro is the lead of this project, and he's the only one lawyer in the world, whom I know at least, who is so engaged into the law TB sphere and who knows the specifics of each regional TB legislation in the world. So it's a pleasure for me to introduce him as a professor based in America, and he will talk about the legal study in 11 countries. Oleg Klemenko, she is the head of the TB People Ukraine. TB People Ukraine recently won the Community Award by Stop TB Partnership, and this is an amazing example of true leadership by Oleg Klemenko. For me, it's really impressive how the person still based in Ukraine, and we know that currently Ukraine in the war, and people in Ukraine, they are now experiencing problems with the electricity, with the heating, but still she had this energy and she have this energy to work and help to be affected people, even though she recently gave a birth to her second child. And we are really glad for Ola, and she will present on the session how the community developed a new draft law on TB in Ukraine. The last but not least will be the speaker from Azerbaijan. She is a member of parliament in Azerbaijan, and she will introduce the view from the parliament, people-centered, right-based TB legislation in Azerbaijan. There's a good work which is doing currently, which has been done currently in Azerbaijan. Our MPs are in a direct contact with our focal points, with civil society organizations, and we are really pleased to have this kind of community connect activities in Azerbaijan. Please kindly note that you will have Q&A tab, so you can write your questions in this tab, and our speakers will be able to reply on your questions directly in the chat, or at the end of the session, they can reply personally if they will turn on their microphones. If you will have any other questions, we will be, or our speakers will not be able to reply to you within this session. We will be able to provide you answers after that session if you will leave us your email. And I'm pleased to give the word to our next speaker, which will be Brian Citro. Thank you so much.
Hello, everyone, and greetings from Chicago. My name is Brian Citro. I'm a human rights lawyer and independent researcher here in Chicago. I want to thank the Union Community Connect for hosting us for this session, and also the chair from Ukraine, Alicia Matsuvich. the Honorable MP from Azerbaijan, Madam Malahat Ibrahimkizi, and also from Ukraine, from TB People Ukraine, Ola Klemenko. And since the session is about Eastern Europe and Central Asia, and also two of our participants are from the Ukraine, I also just want to say that we stand in solidarity with the people of Ukraine during the ongoing war. So without further ado, I'm excited to share with you a study that we conducted through the Global TB Caucus on rights-based, people-centered TB legislation in Eastern Europe and Central Asia. So I'm going to go ahead and share my screen here. So as I said, the title of our study and of this presentation is People-Centered Rights-Based Tuberculosis Legislation in Eastern Europe and Central Asia. So what I want to talk to you today about is the background and methodology of our study and the results. The results and analysis, I'll give you an example of what it looks like. I'm going to share the 10 key results and takeaways from our study, and also the 15 essential recommendations that we've made based on the research. So here, first though, I'll just show you, you could see what the report looks like. So this is the PDF of the report. We have it in both English and Russian languages, given the region. Russian is a common language in the EECA region. So that's what it looks like. And of course, we'll make it available to all of you here during the session if we haven't already done that. So the background and methodologies. The study was conducted through the Global TB Caucus and as a part of the TB Rep 2.0 project. And so the scope of the study was 11 countries that were a part of the TB Rep 2.0 project. Those are Armenia, Azerbaijan, Belarus, Georgia, Kazakhstan, Kyrgyzstan, Moldova, Tajikistan, Turkmenistan, Ukraine, and Uzbekistan. So those are the 11 countries that the study was looking at. What was our study? Well, it's essentially a legal research and analysis study. What we did was we identified and analyzed more than 30 laws from the 11 countries in the TB Rep 2.0 project. And we further categorized those laws into 4 kinds of legislation. So they are tuberculosis laws, so laws that are specific to TB, infectious disease laws that are broader and more inclusive of all kinds of communicable diseases. The third is the public health and healthcare laws, which are even broader still. And then fourth, labor laws, because we wanted to look at the intersection of tuberculosis and employment, which we all know is critically important for people affected by TB. So what did we do? Well, we brought together a bunch of normative analysis or analytical sources. And here's what they are. We broke them into 3 categories. Global TB plans and global commitments, like the End TB strategy from the WHO, the Stop TB Partnership Global Plan to End TB, and the political declaration from the TB United Nations High-Level Meeting. We also use some normative legislative and legal sources. There's a WHO document on good practice and legislation. There is the key considerations for TB legislations from the Global Caucus, activating a rights-based TB response from the Global Coalition of TB Activists, etc. Then we also looked at global TB standards for treatment and ethics. And those include the International Standards for Tuberculosis Care, which are a WHO joint document that provides the most up-to-date standards on how to treat TB, and also the WHO ethics guidance for the implementation of the NTB strategy. So from these sources of norms and standards, what we did was we developed analysis questions. And here you're going to see what those look like. So for the 4 categories of legislation, we made 3 groups of questions. So the infectious disease laws are grouped together with the public health and healthcare laws. And what you'll see here is there's 15, 14, and then 11 questions. What these questions are questions developed using the normative sources that we then looked at all the 30 laws, or the more than 30 laws, and we asked and then answered these questions in order to analyze the law. So for example, for the TB laws, one of the questions is there a list of rights? Another one is disability status recognized? For the infectious disease and public health laws, for example, we ask, are employment rights provided? Is compulsory hospitalization or treatment required or allowed? For the labor laws, for example, we ask, is tuberculosis explicitly addressed in the law? Are workers' health recognized and protected? So these questions, again, were developed using the normative sources, and this is how we analyze the laws. So here's an example of what the full results and analysis look like. So you'll see here, this is for the tuberculosis law. So you'll see that there was 7 countries that had tuberculosis laws, meaning laws that are specific to TB. That's 64% of the countries. You'll see the laws listed here and the countries with the name of, or rather the number of the legislation. And you'll see Armenia there, they have a Ministry of Health order that really looks like legislation, but it's not. Nonetheless, we still included it here. So then you'll see this grid here on the bottom. On the top columns, in the top of the columns, you'll see the 15 questions. So patient obligation, list of rights, as I said before. I think the other one I mentioned was employment rights, compulsory hospitalization. So the 15 columns are the questions. On the left-hand side, the rows are the countries, and then you'll see in the table the answer to the question. So, for example, for Georgia, does the Georgia tuberculosis law provide judicial protection for rights? That's the column number 7, and the answer is no. And then if you go down to the bottom, you'll see the tally or the aggregate for all the countries. So, for instance, the number of countries that provide treatment support in their tuberculosis laws is 75%, and 25% do not. For another example, only 13% recognize tuberculosis as an occupational disease, 88% do not. So this, there are 4 versions of this for the 4 different kinds of laws. But now to get to the key results and takeaways, there's 10 that we are going to highlight here. So the first is that none of the laws prohibit discrimination against people affected by TB, which is remarkable given how pervasive and how terrible or how much of a negative impact discrimination has on people affected by TB and the TB response. Second is that all the TB and infectious disease laws allow for compulsory hospitalization or treatment. Third is that none of the TB laws provide a role for civil society. They don't explicitly talk about civil society, and they don't provide any support or opportunity in the law for civil society or community groups to participate in the disease response. Number 4 is that only one TB law and none of the infectious disease laws protect the rights to privacy or confidentiality, which again is remarkable in part in relation to stigma and discrimination. We know that privacy and confidentiality are important to protect against stigma and discrimination, but only one law and none of the infectious disease laws actually establish and protect those rights. Number 5 is that none of the labor laws and only one TB law recognize TB as an occupational disease for all health workers. Some laws recognize the disease as occupational for health workers, but they don't discuss any other workers, and it's only limited to health workers. Number 6, that only one TB law provides judicial protection of rights or access to legal remedies. So if you have a list of rights, but there's no way to enforce them, it doesn't get you very far. So that's one of the things that we looked at. Number 7 is that only 25% of the TB laws recognize tuberculosis key in vulnerable populations. 75% do not. 75% of the TB laws include lists of both patient rights and what are called patient's obligations. And we'll talk a little bit about those later. 40% of the TB laws do not provide employment rights. 60% do. And all of the infectious disease, public health, and healthcare laws, and 75% of the TB laws provide the right to information. So we end there with a very positive takeaway. So now from these key results and takeaways, and in the context of those normative sources, the global plans, legislative sources, and also the TB standards for treatment and so forth, we developed 15 essential recommendations And these are recommendations for what should be in tuberculosis legislation in the region. Although I'll say that we also believe that these recommendations should apply more broadly around the world. So the first is to prohibit all forms of discrimination of people affected by TB in law. And that includes in healthcare, employment, etc. So discrimination must be prohibited explicitly in law. Eliminate mandatory, compulsory, or forced treatment of people with TB in all circumstances. And this is in line with the WHO ethics guidance. Eliminate mandatory or compulsory hospitalization and isolation of people with TB, except in extremely rare cases, and we lay out what those circumstances should be. This is for involuntary isolation or hospitalization, where by contrast, forced treatment should never be allowed. TB legislation should establish as the national standard people-centered TB care, including outpatient and community-based treatment. And this should be in line with the most up-to-date WHO standards for TB treatment. TB laws should also designate and provide technical and financial support for civil society and community groups so that they can participate in the TB response. That should be in legislation. The sixth recommendation is that TB laws must protect the rights to privacy and confidentiality explicitly. TB should be designated as an occupational disease for all workers who might be exposed to the disease and to the bacteria in their job, not only health workers. Number 8 is that tuberculosis legislation needs to ensure that the rights in the law are judicially enforceable with appropriate remedies. As I said, if you can't enforce a right in court or elsewhere and obtain a remedy, then it's only on paper, the right. Number 9 is that TB law should recognize and afford special attention in the response to TB key and vulnerable populations. And those populations should be determined at a national and a local level as to what they are, who they are. We are also recommending that TB legislation should not include, or they should remove, patient obligations or responsibilities or duties. These things can be included, if at all, in non-legislative guidelines or recommendations for patients. They should not be in law. Number 11 is that TB laws should provide employment rights for people affected by TB. And these are things like paid sick leave, flexible working hours, protection against termination, etc. TB laws should ensure access to social protection and temporary disability benefits as a legal right for people with TB during treatment and afterward if there are lingering medical effects, health effects from TB disease. TB legislation should provide treatment support in law for people affected by TB, and this includes psychosocial counseling, food and nutrition support, and compensation for transportation and other kinds of incidental expenses that are incurred during treatment and before during the testing stage or diagnostic stage. Number 14, TB legislation should ensure that there is sufficient and sustainable financing for TB programs. This includes for both human and technological resources like new drugs, new technologies, new diagnostics. Finally, TB laws should acknowledge and grant institutional authority and responsibility in a multi-sectoral manner. The TB response must be not only done through the Ministry of Health, but it must be multi-sectoral, including other ministries and departments like labor, social protection, etc. So the law itself should actually lay out a multi-sectoral response. So with that, I'll thank you very much for attending this session. And I'll just end here with, again, the picture of our study, which has all these results and a little bit more. Please feel free to reach out to us if you haven't received or obtained this already. And again, I want to thank the union, the Community Connect, and also the Global TB Caucus on the TB Rep 2.0 project through which this study was conducted. Thank you very much.
Good day to all the participants of the Union Conference. I'm Oля Klimenko, Chairman of the Board TB People Ukraine and Stop TB Partnership Ukraine. Ukraine is a democratic country with a wide branching of government bodies. It is very important to approach community advocacy with a solid database. properly drafted documents prepared in the form required by state rules. It is possible to achieve results by following step by step from local program to law. Yes, it requires a lot of patience, time, and of course, resources to attract the necessary experts. But by going through the whole chain of interconnection, you will be able to provide enough arguments for a political decision, for example, the need for a new law to combat TB. Form the agenda using the developed tools. No declaration will change the situation in the country if there is no political will, because there is no accountability mechanism for non-fulfillment of obligations, at least in tuberculosis nevertheless. Existing tools allow preparing better proposal. Thereby improving community advocacy, in addition to adapting the tools, some of which you've seen on slides. We also did research. For community improvement and capacity building, we conduct trainings and webinars for NGOs, healthcare providers, and patients, so slowly instilling a decision for change. For example, we note the reduction of stigma. In Ukraine, the decision on the need for a new law to combat TB was made during committee hearing on TB, led by parliamentarians. But the preparatory process lasted more than a year, so that by the time the question was asked, the stakeholders had a positive answer. Therefore, it is so important to use the evidence base to communicate with representatives of all necessary departments. Forming legislation is a political process, which is why it is so important to have support and interact with NTP. For us, such a partner is the Public Health Center, together with which a working group was created to analyze barriers and develop proposals for elimination. Through the One Impact system, we receive information in real time and we can quickly respond. And through the Stop TB Partnership Ukraine and CCM platform, we share information with the national and regional partners. Our expectations do not always come true. For example, while working on a new law, we faced the difficulty of replacing discriminatory terminology. And the search for an acceptable solution took up most of the consultation. And during the war, the consideration of the draft of law of Ukraine on the fight against tuberculosis was postponed. It is important, not cancelled, but only postponed. We are achieving some targets results. For example, we developed an algorithm in which people without documents can receive medical services. Or that within the framework of financed medical services of the criteria for hospital is the existence of an adapted policy of non-discrimination of people with TB. Standardization of supporting services which will create conditions for equal access for all people who need help. Only systemic changes and existing accountability mechanisms for violating the law will help us achieve global goals in the fight against TB. For this, it is important that each stage responsible person are identified and a pool of partners in the implementation is determined. Quality law, it is joint decision of politicians and civil society, and I wish all of us to achieve it is in our countries. Thank you for your attention.
Excellencies, honorable colleagues, and dear friends. First of all, I would like to salute all participants and many thanks for organizers for invitation to joining such an important webinar where tuberculosis kills more than 1.5 million people each year and it affects millions more with enormous impact on families and the communities. Last years are especially critical in the context of the COVID-19 pandemic and coupled with military conflicts in the world, which are disrupting services for TB and putting an even heavier burden on those affected. Dear participants, as we know, as global challenges, TB is one of the main goals and targets of the SDGs adopted by the UN in 2015 and is included in the 2030 agenda of the world. Therefore, combating against TB requires global cooperation. In this sense, only our mutual efforts will significantly improve access to quality health care services and contribute to a considerable reduction in the number of TB cases and deaths. I would say that after adopted SDGs, the State Coordinating Council for Sustainable Development was established in my country by decree of the President of Azerbaijan in 2016. The head of the council is Vice Prime Minister, and all deputy ministers are member of this council. Under umbrella of this council, the country priorities of SDGs are being continuously discussed year-round. Between the council and the parliament, set up very close cooperation tool, and in frame of action, several events have held in the parliament on SDGs country priorities, including TB and the improvement of legislation on this matter. Dear participants, taking into account the time is very limited, I will try to drive brief information about the situation of tuberculosis in our country and the work done by the government in the fight against TB and the legal regulation in this matter. This presentation, which is now presented to you, reflects the political will of the state in the fight against TB in Azerbaijan and how this global problem is regulated by the documents adopted by the government and the national legislation. The national program for Azerbaijan aims to achieve the goals of the high-level meeting of the United Nations General Assembly on diagnosis and the treatments of TB, focusing on the drug-resistant TB and the TB among children. To date, more than a dozen of regulatory documents on TB control have been developed in close interaction and coordination with state and international organizations based on WHO recommendations. The level of treatment coverage for all forms of TB, including the drug-resistant TB, has reached 100% across the country, achieving 90% TB cure rate. Also, Azerbaijan have made some significant progress to limit the spread of TB. It is drug-resistant forms remain to be in the priority in our country. The COVID-19 pandemic has exacerbated the situation as patients have less access to be tested. With great pleasure, I would inform you that after the establishment of the Global Parliamentary Group on TB, there is also created a special parliamentary group on TB in the Parliament of Azerbaijan, initiated by me. The TB all-party parliamentary group, which consists of 13 members of parliament, represents different political parties represented in the parliament. The TB all-party parliamentary group of Azerbaijan have joined with the Global Tuberculosis Caucus. We as parliamentarians can and are able to regularly meet our ministers, Minister of Health, Minister of Finance, and etc., including with civil society organizations, leaders, communities, mass media representatives, national TB program manager representatives to discuss the impact of COVID-19 on TB. Now we have more opportunities to deal with TB. And as elected representatives, we conduct several parliamentary briefings, hearings, public forum, in the parliament and the different regions on TB to discuss the national TB response. The planned action have been prepared by TB parliamentary group with the health committee of the parliament. Recently held a meeting with relevant employees of the Ministry of Finance regarding the budget allocated to TB in the health budget. Special study tour have been planned to Ankara to learn best practices of Turkey, initiated by TB parliamentary group. TB parliament group good relations with Georgian and some other TB group. Using opportunity, I would emphasize for the great support of our reliable partners as WHO, Stop TB, Global Tuberculosis Caucus, and others. As you see, the most important directions of the plan and the performed works are reflected in the presented slides. I don't want to take much time talking around each slide. Dear participants, I would like to draw your attention to the TB Act passed by Parliament in 2000. It goes without saying that this law, which was adopted 20 years ago, needs to be improved. But as you can see, this law meets most of today's challenges. This law can be called a law human-centered rights based on law. I would like to inform you that this law is currently being expertised by national and international experts, and the improved version will be discussed in the Parliament in the near future. Dear participants, once again, I would draw attention you to the slides, which there are challenges, there are gaps, and our achievements. Thank you very much for your attention.
Dear participants, thank you so much for being with us. Thank you, speakers, for providing such an extended and broad presentations. Now we are slowly moving to the Q&A session. I am reminding you that you have the possibility to put your questions in the Q&A chat box. Our speakers will reply to you directly in the chat box, or they will speak in aloud. If there won't be a possibility to answer to your questions during this session, probably some speakers will have the possibility to reply on it afterwards. I will provide in the chat emails, so later you can just email me to... Yeah, so here in the chat box you will have my email address. Feel free to approach to me. And if still we don't have questions, I would like to ask several questions to the main lead of this project, who is Brian Citro, if you let me. Hello, Brian.
Hi.
And one of my questions will be, what is your current work that you are doing to help parliamentarians to implement the TB legislation recommendations? In which countries, in each region, or maybe broader? So what are the follow-ups of these projects?
Sure. Yeah, thanks, Alicia. Hello, everybody. It's such a weird format to just sit here and watch videos for 40 minutes and not get to talk to anyone. But I see some people here, so thanks for checking the session out. I guess I think there's several pieces of work that are related to or are somehow drawing from this project. We were just talking about one, Alicia, before we started here, but the two things that I'm involved with are in Moldova and then Nigeria. And I actually see that we have a Nigerian colleague here. He may not. Yeah, it looks like he's still here. in Moldova, working with the PAS Center and a colleague or a champion in the parliament, we reviewed the TB law. Moldova has a specific TB law, or a TB specific law. We reviewed it, and then we, very carefully kind of annotated it, analyzed it, and then we wrote up, based on the existing law, we kind of revised and wrote a new law. And it draws heavily on the recommendations from our study. So if and when that comes out of the Ministry of Health, right now it's circling to the Ministry of Health, and we're getting feedback. And we also work with the coordinator of the National TB Program. So the National TB Program was kind of there from the beginning as a part of the process. If you take a look at that law, though, or the draft, you'll see that it does everything that we recommend in our study and more. And then in Nigeria, for a few years now, actually, since 2018, I've been working with an organization called Lawyers Alert. It's a human rights and law NGO that does a lot of work on health. They actually were a part of the processes that led to the Nigerian HIV legislation at the national level, and then also the one that is in the Lagos state jurisdiction. And so there's the head of that group is called Rami Mam. He's a barrister in Nigeria. We've been working together through the Challenge Facility Civil Society grant from Stop TB Partnership over the past year, bringing members of the media, people affected by TB, and lawyers together to build a network. And kind of through that work, we got to know the head of the National TB Program there, Dr. Chukwuma. And there's a strong interest in drafting from scratch a tuberculosis law in Nigeria. There is not a law on TB in Nigeria. There's a handful of laws that are the legal foundation, but there's not a specific law on TB. And so we're kind of in the process of finalizing some support that we hope to receive from the Stop TB Partnership and the Global Fund Strategic Initiatives program. But it would be to work with the National TB Program, Ministry of Health, other relevant ministries, I would hope labor, social protection, et cetera, but also to do a very, very inclusive process that would put at the center people affected by TB, civil society, and we would go to different parts of the country and kind of introduce the idea and learn from the lawmakers and the communities in those parts of the countries to develop a really inclusive law, or develop a law through an inclusive process. But that law, I'm sure the direction that will take a lot of the normative direction will come from our study. So those recommendations that we just presented would be a big part of that. So I'll stop there. But yeah, thanks for the question.
Wow, I'm so impressed about your work, and this is a real example of multi-sectoral approach, what you're doing now in Nigeria. So we understand that TB legislation should not be focused just on, for instance, Ministry of Health, right?
Yeah.
Every stakeholder, national TB stakeholder, should be included, because TB is not just about the sphere of health. It's also about the for instance, judicial system, right? Because we can talk about TB in prisons, and Ministry of Social Affairs, because we can talk about stigmatization. And yeah, I'm really impressed that our TB stakeholders are so engaged, and it's great that MPs are also ready to cooperate and that they are so open. As we have seen, for instance, in Azerbaijan, our MP is ready to meet with civil society organizations, TB stakeholders. So in this regard, in regards of further steps, and maybe for other TB society organizations to know on what they should focus when they will be advocating for the need of TB legislation changes, from your experience, what was the most challenging TB legislation recommendation change for which you have been advocating? Like, what was it? For instance, was it a question of stigmatization, or the question of the forced treatment? maybe you can
The
just.
latter. It was the second one. That's a good question. I mean, so I should also say that in Nigeria there are there's a TB caucus in the Nigerian National Assembly, the parliament, and so we're going to work closely with them on this project that is just kind of taking off. And also there's been a couple other MPs who have come and gone for in the political process who've been very active with the Global TB Caucus, and so I don't think there's no way that we could even try to do this work in Nigeria unless that was the case. So the work that the Global Caucus, TB Caucus is doing, that you guys are doing, is critically important because it sets the foundation for knowledge and interest in the disease in the first place among lawmakers. So that's really important. So Alicia referenced that this report that I was talking about is actually a part of a much larger process where we had 3 workshops over the course of about a year, maybe a year and a half, in where we had people from all over the region, from the 11 countries, both TB survivors, people working in civil society groups, and then also members of parliament themselves, and doctors, global and regional experts on TB, medical doctors. And during one of those, the main meeting where we had everyone together, members of parliament were present and participating, there was a huge discussion on compulsorial treatment or mandatory treatment. And it was, contentious, I think, in a good way, because at least we were having the discussion. In the recommendations, we make a distinction between forced treatment on the one hand, which would be like literally putting, a pill in someone's mouth. How else would you do it? And that is never allowed. And that's a very easy ethical and human rights, question, because the answer is you can never do that because of informed consent. And the WHO ethics guidance is very clear about that. On the other hand, involuntary isolation or hospitalization, where you're not forcing someone to take medicines or put anything in their body, but you're isolating them against their will. That's a much thornier question. But there's an important distinction between those two, right? And it seems, even as a human rights lawyer, it's easy to think of situations, unfortunately, where someone's right to liberty is possibly overruled, or it's weighed against their right to liberty because of the danger that they pose to others. But as we say in the report, it's very extremely rare circumstances. If you're doing that in your TB program often, then you're doing something wrong. Not just because you're doing that, but because if people are getting to the point where they're contagious and putting others at risk, often there's a lot going on in the program that isn't working for people to get there in the first place. So based on the WHO ethics guidance and on some other research that I did actually with the person who wrote the guidance, who's an ethicist, public health ethicist in Australia, there's a lot of circumstances that we lay out as to when involuntary isolation should even be considered. Mm-hmm. However, to get back to answer your question, that those were the issues that are the most contentious. And when we were actually talking with the lawmakers who made the laws in the country, there's a lot of sensitivity around that. I think there's also a lot of openness to have that conversation. So I was impressed by that. But I think that moving forward in the region for sure will be the most difficult thing, because if you look at the report, you see all the different laws on TB and infectious disease. Almost, I don't want to say all because I may be remembering it wrong, but almost all of them, if not all, something like 90%, allow for compulsory hospitalization. Mm-hmm. And sometimes it's not clear whether it's just isolation or treatment. So I think that's a huge thing moving forward anywhere, but especially in the region, given that the laws there allow that at the moment.
Yeah, and so there's a need to change mindset of our MPs as well, because I remember some discussion between Tajikistani and Belarusian MPs when Tajikistani MP was pretty impressed about the level of treatment in Belarus, but still they have this compulsory treatment. Yeah. But Tajikistani MP said oh, they are in a good position, these TB people, so probably it might be good because they have a good food. So why not?
Yeah, I remember that. Yeah. Yeah, I mean, yeah, that's a great point. You know, if you look at a country that seems to be doing better than you, but they have some things that maybe are not good, it's easy just to embrace all of that rather than thinking more carefully about, you know, providing good treatment and food. It's not necessary to be, you know, to do it in an authoritarian way where you mandate that people do that. But you're absolutely right. There is a lot. I mean, it's great that countries are looking back and forth, and that's what part of this project was actually to facilitate that discussion, right? And I think the Global TB Caucus is the only organization in the world that I know of that can do that on this disease. And actually, I don't know of any other caucus like this for other diseases. So it's very unique. But I do see one question, Alicia. Maybe can I just answer that quickly? It's
Yeah,
about,
I wanted
it
to
says,
read
I'm
it.
not sure
Yeah.
if folks can see this, but he said, did you mention press? Or yes, I did. And did Nigerian press help you guys get public support? So the answer to that is the project that I did over the last year with Lawyers Alert in Nigeria. We were very lucky to get maybe a dozen or so independent members of the press working for different newspapers in Abuja and Lagos. We're lucky to get them to be a part of our project. So they were there sitting with us in the workshops for 2 days, presenting and engaging directly with people who had served TB survivors and with lawyers. And during the time that I was there was about, I would say, maybe 5 to 10 news stories that were published just during that week that I was there. And then since then, those journalists have remained engaged in what's happening with TB, whether it's individual stories of people who have had TB or looking at more of kind of the health systems level. So, you know, whether or not that means we have public support, that's a bigger question. But we definitely have been successful just so far in the beginning by to engage members of the press to get them to just cover the issue of TB. And hopefully over time, and especially if we do this TB legislation project, I think we're going to have to rely on those members of press and their ability to raise public support, as you're asking. But I wouldn't say that we've achieved that yet, but that's certainly what we're thinking.
Yeah, thank you so much for your answers. And this is a confirmation about the need of multi-sectoral approach, not based just on TB national stakeholders, but even broader to include media, because we know that it should be considered as the real force, right, in each country.
Yeah.
So I think we can go to the conclusion, and if there's no questions, I think we can finish our session. I'm really grateful to our speakers, to Brian, who led this project and who is doing the great work in the world on TB legislation work. Your work is really important, and our members of parliament really appreciate this. And we are grateful to everyone and ready to cooperate further. Thank you so much for the organization of this session, and we can keep in touch. Thank you so much.
Thank you,
Bye.
everyone.